Welcome to Scrubbed In and Speaking Out, the podcast from the Registered Nurses Union, Newfoundland and Labrador. Here we dive into real issues facing nurses and the advocacy shaping the future of public health care in our province. Once again, I'm joined by our RNUNL President, Yvette Coffey.
Good day, Dan.
Hello. And so today we want to talk about retention. What we know is when we turn on the news, a lot of time recruitment is what's making headlines. How many nurses are being recruited? We know we've heard a lot of talk about nurses being recruited, the percentage of nurses being recruited right out of university. All of that is positive. We want to see more nurses recruited, obviously, but we also need to remind everyone from time to time that retention is a critical issue. Because it doesn't matter how much recruitment you're doing if you're not retaining nurses.
Absolutely.
So we just want to dig in a little bit on why nurses leave the profession. And then I think we want to talk about some solutions and some answers about how we keep nurses. So let's just start maybe with why you think retention doesn't get the same focus. Like, why are we so concentrated on recruitment?
So I believe, everything is driven by media, of course. You can talk about one thing and, do a 20-minute interview with media, and it's only little bits of that interview, 30 seconds, 60 seconds that's actually taken and shared. It's the same thing when we're talking to government and we're talking to the health authority. And we know that recruitment is a big thing because of the nursing shortage. 2 years ago, we had almost 750 nursing vacancies in this province. It's now down to almost 300. But we've also been talking about the retention. And even federally, globally, internationally, that is where the focus is and has been on nursing. And even though we're having those conversations out in the public and we're having those conversations with government and with the health authority, it still needs a lot of work and it needs a lot of attention. One of the things we have done is I participated last year, I think it was last year, maybe it's a year and a half ago, with a summit orchestrated by the federal chief nurse, Dr. Lee Chapman. And it was co-hosted with Canadian Federation of Nurses Unions, Linda Silas. So I went on behalf of RNU and CFNU. There was a lot of stakeholders. There was people here. There was an LPN, an RN. There was also our chief nurse was there, provincial chief nurse. And there was people there from NLHS. So everyone heard the same thing. And what came out of that was a federal Nursing Retention Toolkit. It boggles my mind that it hasn't gotten more attention in the media and in the public. Because even the public, when I talk to them, like at the regatta, at the Seniors Resource Net, they're like, so what's the problem with keeping the nurses? So maybe it's the wording. Maybe they just don't get the retention piece. Maybe it's, say to keep the nurses in the system and keep them from leaving. But we've taken that federal retention toolkit, and what we've actually done with it, we have a provincial nursing network, which we negotiated the last round of bargaining. And at that committee is every single stakeholder in nursing, for regulated nursing, LPNs, RNs, nurse practitioners, educators, the colleges, the employer, government, and all the unions. And we have frontline representatives on those committees. We put out a call to all our members. We have a nurse practitioner, two registered nurses, and there's a licensed practical nurse. Actually, there's two nurse practitioners on this committee at present, along with managers and that. And what we're actually doing is taking that retention toolkit and going through all the themes and working on each theme. And as we're signing private agreements with the health authority or with government on, a fly-in, fly-out option for Labrador, say, or a travel locum, or the permanent positions that are now posted that you take a permanent position in Labrador, but you actually don't have to move to Labrador. You go in for 2 weeks and you're home for 2 weeks. So coming up with all these different ideas and plugging that into the retention toolkit. So work is happening behind the scenes, and maybe it's the wording. And other than that, I'm just as puzzled as you were, because I really do believe there was such a focus on recruitment with the 750 vacancies that it's taking a while to get retention to be the top thing when it comes to the public.
If it's not the numbers, like we have statistics on vacancies, we have statistics on recruitment. What statistics, and behind the statistics, there are probably other things we need to know, but what statistics do we have about when people are leaving the career? And further to the numbers, like why are they leaving, right?
So we don't have those statistics. We have asked for them. How many have left the profession? Like, don't tell me how many you recruited. Tell me how many is left. Like, what's the status quo? Also, we've been in discussions with NLHS, and it started with Lab Grenfell because they have such a high vacancy rate, doing exit interviews with staff. And Health Science Emerge was another example where we were advocating, you don't just do exit interviews because of people leaving the organization. You should be doing them. If I leave my position, say, Emerge at the Health Science, and I go to work in ICU at the Health Science, why did I make that move? Like, what was the impetus for me to say, okay, I'm done with Emerge and I'm going? And NLHS guaranteed us that, they are doing that and will be doing it. And what it is, and people don't even realize it, is a link. You get an email saying you're now going into this position, and there's a link there for you to do the survey. In places where we've had mass exodus of staff, like Health Science Emerge, such Goose Bay, we ask, you should be doing face-to-face meetings with these people, because a survey link is just not cutting it, and people aren't doing it, right? So we're hoping to get better with the new Epic system coming on and that, and new technology. Hopefully we'll have the resources in that we'll be able to capture more of that data and capture the rationale as to why people are leaving.
Right, which is so important. And I guess it's up to us to make sure that it continues to be part of the public conversation.
Absolutely.
So moving on, we hear a lot of stories about why people choose to leave the profession. What do you believe are the main factors that are causing nurses to reconsider their career choice?
The number one reason from what I hear from nurses, and when we did our provincial tour and that, is the workloads, the mandating of overtime. Only yesterday I heard about a nurse that just worked a 26-hour shift. I mean, that's not safe for the nurse. That's not safe for the patients that they care for. Also, the violence. Recently, in the past few months, we've had at least 3 people charged at the health sciences, the public, for incidents of violence. We are working with NLHS, talking to them every time there's an incident and that. I think our biggest challenge there is nurses knowing their rights when it comes to refusal of unsafe work. We know it as labor activists, but every single registered nurse or nurse practitioner does not know workplace and NL legislation, nor do we expect you to know it. I mean, that's our role. But our role is also to educate our members to say, you don't have to take it. If we've talked to the college about what hour is it that you should stop? Like, at what hour? Is it 14 hours? Is it 16 hours? Is it 26 hours? And the college's reply has always been they have no policy or anything on the number of hours you can work consecutively. Mm-hmm. The impetus, the onus is on the registered nurse or nurse practitioner to say, I'm too tired and fatigued. I'm not thinking straight. I am not fit to practice at this point in time. And I think that's the key message, So it's the mandation, it's the workloads. So you're working and you don't have the proper resources or support staff in place. In some rural, remote areas, you're it. You are environmental services, you're dietary, you are the social worker, you're the physio,
Ambulance driver.
right? Ambulance driver, you're everything. So all of these factors contribute. Lack of childcare was one of the big things we heard with the nursing think tank, and the lack of flexibility. So that's why we are at the table having discussions around alternate work arrangements, alternate scheduling, so that we can get people into permanent positions.
Okay, so that's a natural segue into solutions. So, what are the solutions that we're proposing? You talked about flexibility, so like flexibility in scheduling.
So at the last round of bargaining, we had already established with the provincial chief nurse and representatives of NLHS presently. It was Eastern Health at the time, but we developed what was called self-scheduling guidelines. And what we did at the last round of bargaining is we fought to get them included in our collective agreement because we were having so much trouble with managers saying, "Oh, well, I don't have to do that. Like, we're going to do the master schedule. That's it." So having it in the collective agreement gives us the right to decide among yourselves in your unit that you want to do self-scheduling. I can tell you from personal experience, when I worked in the coronary care unit at the health science, we did self-scheduling. We did it for every schedule, and we did it for holidays.
It works for vacation too.
It works for vacation too. And what we did was, it wasn't always every year, okay, Yvette's senior nurse, Yvette gets top pick of vacation. No. What we did was we alternated every year. So we divided both our all the nurses in the unit, senior to most junior. So we had two, equal numbered columns. Column A had first pick this year and then rotated among themselves. Column B had first pick next year and rotated among themselves. Everyone still gets their vacation, but everybody had an opportunity. And I keep saying to nurses, and I've said it to them over the years, if we do not allow a process for our new nurses, our new colleagues to have vacation, we're not going to retain them.
Yeah. And we're hearing that from not just here in Newfoundland and Labrador, but across the country, that nurses who have earned those holiday days, vacation days, that's their right, are having trouble booking them off. So that's not just an issue here, but across the country.
Absolutely.
And you mentioned childcare spaces.
So childcare came out of the nursing think tank. It was one of the big issues why younger nurses, childbearing age, were not entering back into the workforce. And this is not just for nursing. This is for every single profession and worker in the healthcare system. Because once it becomes that you can't get childcare, or a childcare is not affordable, it's more, it costs you more for childcare than your paycheck does. That's not sustainable. So you're just well off to stay home. And we heard that from a lot of nurses. That was their rationale for not taking a permanent position. They would take a casual, but not a permanent. So we entered into discussions with the Department of Education and the Department of Health, and they also entered into discussions with the federal government, and there was federal money. And around the same time, the federal government was announcing the $10 a day childcare. Newfoundland and Labrador signed on to that right away. We were one of the first provinces. We'd made it more economical for people to obtain childcare. But we've also, since we started those discussions and that committee, we've created 2,500 additional childcare seats in this province. And we have several of those seats earmarked for healthcare workers.
Awesome. Okay. So those are some big ones, the flexibility in scheduling, flexibility with regards to, of course, to having childcare. Those are important things. But I guess, obviously, we mentioned workload. We need more resources. And, of course, violence. So we're seeing in other territories and provinces, we're getting ratios built in. What solutions are we looking at, or do we want to think about when we talk about the violence in our system?
So I have been advocating, along with Federation of Labor and other healthcare sector unions, for a health sector safety council. So it's an independent health sector safety council that would address violence, workplace injuries. We know that healthcare has the highest rates of injuries in this province. The last stats that I had from a couple of years ago, every second day a registered nurse filed a claim with Workplace NL for a workplace injury. That is, I mean, how are you going to keep people in the workplace if we're injuring them every day or they're being assaulted? So we didn't get a health sector safety council. We're still advocating for that. What we did get is an offer from Workplace NL, so Workers' Comp, and Newfoundland Labrador Health Services to enter into a tripartite committee and to embed two coordinators into the healthcare system with a target, initially, to address violence and workplace injuries. That's just getting off the ground. We're just getting the terms of reference approved for that. It's not what we wanted. It doesn't cover all of the healthcare sector, such as home care or personal care homes that are not unionized. It's only NLHS. So I do have big concerns with that, and we've all expressed those concerns. But it's a start. It is something. And I do believe that we've talked about violence enough in healthcare, and with the latest charges being laid, that it is becoming more visible and more of a topic out in the public. And people are recognizing, oh boy, how do you work like that, right? So addressing violence is big, and it's something that the union will never back down from. If you go to work at Walmart, if you go to work at the Health Science, if you go to work in Goose Bay, you were supposed to have a safe workplace. And that doesn't mean just physically safe, that means psychologically safe as well. And we are seeing an increase in psychological injuries. And that's something we're also advocating for, is changes to workplace and health benefits, so that all of these workplace injuries are actually covered.
So that's a lot of ground, and obviously this is such a complex issue. There's a lot of fronts, and there's a lot of work that all of us can do. And like anyone who worked in the healthcare sector, a lot of this is about prevention. Nurses understand that more than anyone. But now you've had a long career in nursing, and I think I don't know if I'm speaking out of turn, an enjoyable career in nursing.
I have.
Yeah. So if you had a magic wand and you could wave it and improve workplace safety, most importantly, retention. So if you could make some specific changes, right, to make the profession a sustainable career choice, like what does that look like for you?
I mean, I have had 35 years of nursing under my belt now, 30 years at the bedside. I've worked orthopedics, I've worked outpatient department, I've worked at a cancer center, and I worked ICU and coronary care. And the majority of my career was actually in critical care, where I actually sustained 2 workplace injuries and had back surgery, 2 back surgeries. So I get the workload issues. I get the violence. But I've also been a union advocate ever since I graduated, because one of the first things that happened to me and prompted me to call RNU office, which was then NLNU office, was I was getting married, and I had asked for 2 weeks off after my wedding in August. And I was denied those 2 weeks off. I got that weekend off, but I was denied the 2 weeks. Everybody had had their annual leave. And the senior nurse came to me, and I was just graduated, 1 year, and said, that annual leave you were looking for? Manager just offered that to me and all those senior people, even though we already got our 2 weeks. And at that point in time, the light went off, and I was like, I think it was a red light. And I said, yeah, that's not happening. And I made my first call down here to the office, and it was actually Sharon Tucker. God rest her, she's passed now. And from that day forward, I became a union advocate in the workplace. And I did get those 2 weeks off post-wedding. So we all have to be our own advocates too. And if there's any advice that I would give to anybody, any registered nurse or nurse practitioner, is to become active in your workplace and to have a voice. Because my voice out in the public, the face of RNU is one thing, but we need your voices. In order to change anything in healthcare or anything anywhere, we all have to work together. And we have been engaging with members. We're doing our provincial tour because we want to hear exactly what it is happening in your community, in your institution, in your clinic. And after doing Labrador and the West Coast, I'm happy that we're getting ready to go to Central next weekend, actually, after the long weekend, so that we can get to talk to our members out in all of those communities as well. And we look forward to seeing you. But even some of the takeaways from our tour that we've done so far actually lays the groundwork for what we need to be working on here at provincial office, along with our members. But unless you tell us all those things that are going on, we can't do anything about it. But we also need your support. We need to be working together. And, we've already told the employers and government, we're willing to sit down, and we do. We're coming up with solutions and ideas. We're getting solutions and ideas from you, members. A recent example of working together is a group of care facilitators having issues with staffing. And I said, we had several meetings with the employer, and people are still frustrated because it's a new central staffing model that we now are going to with all of NLHS, by the way. And if we don't get the kinks worked out at the health science, it's not going to be very good. But we were there talking one day at the last meeting, and I said, how about if we have concerns that the people who are doing all this centralized staffing do not understand the role of registered nurses and what our scope of practice is and what skill mix means and what in charge means and being able to do in charge. Why don't we ask if we can actually embed a couple of registered nurses there to give that advice, to give that knowledge, right? To share the knowledge of what's needed for the floors, the clinics, whatever. And I'm happy to say NLHS actually was like, that's a good idea. And the nurses thought it was a good idea. So next steps is trying to work that out. Mm-hmm. And as you've seen with the recent announcement for the nurse practitioner funding model, we've been talking about it a while. It takes time. Nothing happens overnight, either with the health authority or with government. The wheels are very, very slowly moving. I do tell the Premier, I tell the Minister of Health, I'd like it moving a whole lot quicker. I do think that there are some steps that can be avoided to expedite things. But we still continue to keep working with our stakeholders. And we need your support and your help on the ground as well, so that we're all working together.
That's a great piece of advice for everyone to get involved with their union, get involved in their workplace, and like all of us, work together to find solutions. Thanks, Yvette, once again, for speaking out.
Thank you.